Okay, with this last part of the notes, we're just going to touch on a couple more viruses, is all. Um, and just to remind you again, a virus is technically not a living thing because it requires a host cell to reproduce. The other thing about viruses is they are very difficult to treat. I don't know if I really said that on the previous notes, but you guys kind of already maybe know that things like the flu or a common cold um, a lot of times don't really have a treatment. Same with chickenpox or mono. There are some things you can do to help with the symptoms, but there's not really a treatment that works like we would see with antibiotics and bacterial infections. So, move forward here. We just got a couple more to touch on that are either interesting or things that maybe you've interacted with before. So, first one that you've probably had in your life, and that is influenza. So, when we talk about influenza, the flu actually comes from a group or a family of viruses called the orthomyxoviruses. And there are three types of flu virus. Influenza, A, B, and C, all are RNA viruses. They have a helical capsid, like you see here. And similar to the SARS-CoV-2, coronavirus we talked about, they've got these proteins that are embedded in the surface of the envelope, the surface of the virus. We don't call these spikes like we do with coronavirus. We actually call these by their specific protein names, and there's two of them. Right? So the flu virus contains hemagglutinin, which is H for short, and neuraminidase. So these are fun words to say. Neuraminidase being N for short. And so these two proteins, which you see here in this picture up here, they got them kind of drawn as two different things. These are how a flu virus gets its name. So you may be aware of different strains of flu, uh, and all the different strains of flu are H something N something, right? So H1n1 we'll talk about here because that was the one with the most recent outbreak. You guys were younger kids then. But H1n1 is a big one. H2n3 is a big flu that's kind of famous. H5n1 is another. And we did that little activity where we looked at the Spanish influenza back at the start of online school. And so that was, one of these as well. Now, as I mentioned, kind of most recently, we dealt with H1n1, a particular type of H1n1, referred to as the swine flu because we believe it bounced over to the to the human population from pigs. When I was younger, probably before you guys were born, there was an outbreak of H5n1. That one was referred to as the bird flu or the avian flu because it similarly kind of bounced over to humans from birds. Both of these flus certainly were a lot more catastrophic in Asia and other parts of the world than they were in the Americas. And so, as I put here, this H1N1, when you guys were in grade school, proved not to be as devastating to the U.S. as people were expecting it to be. Also, we want to talk for a moment about the flu shot. Personally, I highly recommend the flu shot. I'll be honest, my parents, my family were not big on the flu shot, so I typically did not get one when I was younger. Then I went to medical school. I learned a lot more about it. It was required when you were in medical school. And so since then, I get one every year because I do believe that it's worthwhile. Now, a lot of people kind of misunderstand the flu shot. We've already covered a little bit of this stuff, but there are many different types of flu. And based on how your immune system works, you really will only get a particular flu one time. And then you won't get it again because of your secondary immune response, that adaptive part of your immunity. The trouble is that there are a number of different flus. So, that means that the typical person will get the flu, a number of times throughout their life, and they'll get these different types. Now, every year they make a flu shot, the CDC, in conjunction with some other groups, And what they do is they try to predict the 3 to 5 most common types of influenza that they expect will be prevalent in the coming year, right? Typically what they do is they take sort of like the 2 or 3 most common types of flu that we saw in the current year, and they include those in the upcoming flu shot for next year. And then they use their research to predict a couple of others potentially. And what they do is they use, a protein, an antigen from each of those flu viruses, and put it in that injectable medium that becomes the shot. Now, this means a couple things, right? This means, one, flu shots, no matter what, they cannot make you sick. A lot of times people believe that. A lot of times that's why maybe your parents or grandparents say, I'm not getting a flu shot, because every time I get the flu shot, I get the flu. Well, that's just an unlucky coincidence if that happens. And it can happen, right? If they come in contact with a type of flu that, wasn't part of the shot. But the shot cannot give you the flu, the traditional flu shot. So don't worry about that. The second thing to keep in mind is that it's just not perfect. Like I just said a second ago there. There are other types of flu out there that aren't protected by the shot. So each year, you could still get the flu even if you've had the flu shot. And some years they do a better job of predicting than others. But the reality is, no matter what, if you get a flu shot, which usually health insurance will pay for, you are covered for those 3 to 5 types of flu. And so it improves the chances that you won't get the flu, in that year. Let's talk real quick too. I kind of forgot about symptoms, right? The flu is going to give you some aches and pains. The flu might sort of be like a cold, so you might have, sinus symptoms, sore throat, runny nose, stuffy nose, sneezing, those sort of things. Sometimes you might include, vomiting. Not always, just kind of depends on the type of flu and the person that it infects. But then the biggest one that I would point out is fever. Right? This is typically how you can tell the flu from a cold, is that the flu is going to have a fever. So if you have a patient with aches and a fever and chills and those other kind of cold symptoms, then pretty safe to say they probably have the flu, and so you would do a little nasal swab and test for that. Now, I put this picture in here because I think it's kind of funny, right? So, again, back when you were in grade school, we had an H1n1 outbreak, and it did cause a good number of cases in the United States. But, symptoms for H1n1 were vomiting, fever, and making paranoid people look silly. Now, this is interesting to me to leave in these notes this year, where we are social distancing and taking pretty drastic action to try to avoid this COVID-19 outbreak. So I hate to make light of these sort of things, but really, when the H1n1 flu virus came, it really, at least in the United States, was no worse than the typical year's flu. It didn't really make people sicker, and the reality, when all was said and done, is that it actually didn't cause much more death than the typical annual flu causes. It did what we anticipate these sort of things will do, right? It did kill people with weakened immune systems, kind of like we've talked about with COVID-19. But otherwise, it didn't end up being that severe. But some people really flipped out. And while you didn't see these national mandates for, social distancing and whatever, you did see enhanced precautions at hospitals, and you did see lots of recommendations of things you should do. And at the end of the day, it was kind of blown out of proportion in that case, which is not, in my opinion, what we're seeing now with the coronavirus. But it also raises another interesting point, and that is that sometimes they do kind of rush too much. So in the case of H1N1, they actually rushed to develop a nasal active virus vaccine. Now, this meant that you would, sort of blow it up the nose like a nose spray, and that it actually contained active viruses of H1N1. Now, obviously, they knew this was really dangerous if you did this to someone whose immune system was compromised, but they claimed that if you were healthy and had a fully functional immune system, this would not make you sick and it would give you that immunity you sought. Well, this was a bad mistake, right? What they actually ended up doing is leading to more spread of the virus with this vaccine. So I would expect that they won't make a similar mistake this time around with coronavirus, but be aware of that. And when they do release some sort of vaccine here in the coming months, which I'm sure they will, do your homework. Have your family, do their homework and see what it is. And if it is a live virus or an active virus vaccine, I'd be a little weary of it. Versus one that's just an inactivated situation or an antigen, like we said with the flu shot. And that would be safer. All right, second one I dropped in here a couple years ago because, interestingly enough, it was one that nobody used to get. And then around the time I was in med school, we started to see people with cases of this again, and that is measles. So measles, or also known as the rubeola virus, is actually from a group called the paramyxoviruses. Measles, again, was a disease that we didn't really see, at least when I was a child, and for you guys too, when you were a little kid, we didn't see measles. And in fact, we saw something like single-digit cases each year in the United States. Now, if you were to get a measles infection, you would see these things. You would see fever. You would see a runny nose or rhinorrhea, right? You would see a cough. You would see red eyes. We call this conjunctivitis. So the eyes would look inflamed, right? And then a sore throat. And then right after you get these symptoms that again kind of look like a cold or allergies or the flu, you would get this rash. Very splotchy over the entire body. Typically not real itchy. Unlike chickenpox. Chickenpox was like blisters that really itch. This is more smooth. So this is not really raised on the skin. It's just these splotches, and it might itch or it might not. Now the other thing that's interesting about it doesn't really go with this here. Another thing that's interesting and totally unique to measles is a phenomenon called Koplik spots. Now, Koplik spots, if you can't tell, we're in the mouth here in this picture. And on the gums and on the side of the cheek, you'll see these dots in the mouth. And these Koplik spots, again, are only seen in measles infections. So this is sort of like your telltale sign of a measles infection is Koplik spots. That's something you would always look for. If you feel like you might be looking at a kid that has a rash that could be measles, you would ask to see inside their mouth, and you would look for these Koplik spots. Now, measles is dangerous mainly because it's so contagious. It's an airborne virus, passes from person to person pretty easily, and can spread very rapidly. Now, the other thing that you would always do if you had just an inkling that someone might have measles is you would ask, right, have you had your immunizations? All right, because almost everyone, when they were a child, received the Mmr Vaccine, all right, which stands for measles, mumps, and rubella. Okay, now, I received that, you guys did. This dates back a long way. And this vaccine is highly effective and had, really by the time I was a kid, pretty much eliminated measles, mumps, and rubella in the United States. You still see those in other countries where they don't have maybe the level of healthcare that we do, but in the United States, those were gone for the most part. Again, maybe single-digit cases. The CDC even declared that measles was eliminated from the United States in the year 2000. Right? And in fact, the only cases they reported were because of international travel. People went to a country where you did still see higher rates of measles, and strangely enough, they got the measles, which was probably, some kind of mutated, kind of slightly evolved form that, your body wasn't prepared for. But then a strange thing happened. And if you look at this graph, I couldn't find a similar one. I was hoping to find a really similar one to this, but you see this was a couple years ago now. But in 2010, cases jumped to 63. 2011, 220. Right? And then as you notice, we are not, going at a steady increase, but look at 2014, 667 cases of the measles. And since 2010, we have always had at least double, if not triple-digit cases each year. Now, these outbreaks are the result of people skipping vaccines. You might see stuff about this maybe on the internet or something. We call it, the anti-vaxxers, people who are against vaccination. Everyone's entitled to their opinion, but what I can tell you from my experience in medical school is that there is not harm that can come from particularly the MMR vaccine. Every once in a while there is a new vaccine, and you got to wonder if maybe we're going to find out down the line that there's something that bad that could come from that. But the MMR vaccine has not been scientifically shown to cause any kind of problems in people. The biggest case that many of you guys are probably aware of is some people who began to believe that autism, which we still don't really know a cause for, was associated with childhood vaccines. This was actually published by a British journal called The Lancet, and it published a study that suggested that autism might be associated with vaccines, including the MMR vaccine. And that spread, kind of in our modern age of social media, like wildfire, right? A few celebrities got behind it, and you feel for them because they were probably celebrities with children who suffered from autism. But it just spread and spread and spread. Well, meanwhile, that journal, The Lancet, published another paper that showed that the first paper was incorrect, that the data was not accurate. And so, again, to this day, there's no scientific evidence that vaccines cause autism, or that the MMR vaccine in particular causes any trouble. Now, you can't force people to do something, right? You can't force people. A lot of pediatricians today will choose not to keep patients if their families don't want their kids vaccinated. That's allowed, but you can't force a vaccination on someone. But unfortunately, a decent number of people are still choosing not to vaccinate their kids. And what happens is that now we have a group of people in the country who do not have immunity. And what that allows is for, obviously, them to catch the measles or the mumps. But it allows the virus itself, that measles virus, to almost like kind of gain some traction, right? It gives it the ability to potentially mutate and evolve and spread from person to person, versus a situation where if all of us are immune, we call that herd immunity, then we don't really see the spread of the virus, and it can get to the point where it's eliminated. But enough people now are skipping the vaccines that there's a group of the population that can actually spread this virus, and it becomes a health risk for all of us, because again, if it mutates in those individuals, well, that might mean that we could catch it too, even though we've been vaccinated. Now, I brought this in here too, just to give you a real life kind of case of this. It's quite interesting, and it's a medical ethics kind of question here. There's not a good answer, but this is published, like you see here, by the New York Times, and about a year ago, basically April 2019. The mayor of New York actually declared a public health emergency in a particular part of Brooklyn, a neighborhood called Williamsburg, that required unvaccinated people to receive the measles vaccine. And again, you can't really force that, so what they did is they basically put in penalties, right? You could get cited, you could pay fines potentially if you didn't comply with this. If you look at this real quick, so in April of 2019, there had been 465 measles cases reported since the beginning of the year. And in this week in April alone, there were 78 new cases. So if you think about that chart on the last slide again, we had eliminated this from the country, and then there's 465 cases already in April of 2019, according to the CDC. You also saw that there were hotbeds for this, right? In 2018, New York and New Jersey accounted for over half the cases of measles in the United States, similar to how those really highly populated areas are your hotbeds for the coronavirus outbreak that we're seeing. And it has to do a lot with just the number of people, those high population numbers. But then this article also goes on to kind of talk to this lady, or quote this lady who did not believe in vaccinations, right? She had 5 kids, said none of them will be vaccinated, and that you cannot force a medical procedure on someone. And then she goes so far as to point out that, every minority that has a different opinion is marginalized. She makes a point, right? But this becomes a question, too, of affecting the safety of others. And that's why, again, it's sort of a medical ethics type question. While, yes, it's probably not right to force this woman to vaccinate her kids, the question is, if her kids aren't vaccinated, that actually might put other kids at health risk. So kind of similar to, this isn't the greatest analogy in the world, but cigarette smoking. Right, once we had really good scientific evidence that secondhand smoke was dangerous, you saw a lot of legislation put in place. You saw smoking leave restaurants and other public places because the smoking choice still belongs to the individual, but them putting other people at risk is where there's an issue. And so vaccination, I think we will continue to see as an interesting issue because it straddles this line of what is an individual right versus what is something that endangers others in the community. Now, also, one more RNA virus, one I hope that you haven't had any kind of interaction with in your life or for your loved ones, but one that I'm sure you're all aware of is HIV, the Human Immunodeficiency Virus. HIV is a part of an RNA virus group called the retroviruses, and retroviruses are really interesting. HIV in particular has kind of 2 pieces of RNA. This virus behaves kind of like the way a virus was described earlier in the notes, in that it gains access to your cells, takes them over, and then leaves the cell through budding. But what they do is they particularly attack the human immune system. They attack T cells more than anything else, and they carry an enzyme called reverse transcriptase, which is a mouthful, but it means that it can do transcription in reverse. So what these viruses do is they carry RNA, they convert it back into DNA. They do transcription in reverse. Then they incorporate that into the host DNA, and from there they make more viruses, right, by doing transcription and translation. Now what this does is, when I come up here, it increases HIV, or actually, let me get rid of that. So it increases these cases of HIV particles, right? Increases the number of viruses, while at the same time, right, it effectively decreases your number of T cells. So while these viruses kind of take hold in the body, they decrease the efficiency of your immune system, or the effectiveness of the immune system. Now, HIV is something that in the 1980s became much more prevalent in the United States, and people really didn't understand it. People were afraid of HIV. They didn't know how exactly you could catch it. But the reality is that HIV is only transmitted through bodily fluids. In fact, to really catch HIV from someone, you almost need bloodstream to bloodstream contact. That's not quite true, but that's kind of the truth. So, like, you would need to have a cut on your hand, and then have someone else's blood enter that cut. So this is why it is very important for healthcare workers to wear gloves and things like that. But it's not. Let's say it's not easy to catch HIV from someone. Not anything like the coronavirus or cold or measles, things that are airborne. You have to have that body fluid contact. And back in well, I don't want to say that long ago, but it used to be that HIV was highly sexually transmitted. Right, and you may already know how HIV transmission has a little bit higher rate, particularly in gay males. That was a big piece of kind of the epidemic that we saw in the 1980s. But nowadays, HIV is a bigger concern, particularly in our part of the country, because of intravenous drug use. In other words, dirty needles. Right, and we don't mean that people are picking up, I mean, this might happen, but we don't mean that people are picking up rusty needles in the gutter and using it to shoot up drugs into their arm. Again, that might happen, I guess, but primarily what we're saying is that the people are not using sterile needles, right? So a needle that looks clean and might even have been washed or something, if it has entered one person's bloodstream and then another person uses it to inject drugs, again, even if you've cleaned that, if it hasn't been effectively sterilized, that needle can easily transfer viruses or cells from one person to the next. And again, so in our part of the country, intravenous drug use with dirty needles is the main way that HIV is transmitted. Again, it can definitely transmit through sexual fluids, and it definitely does. But typically today we think about drug use worse. And I looked this up and put this on here, which is just crazy up here in the corner. The CDC estimates somewhere between 920 million and 1.7 billion illegal injections occur in the U.S. every year. So obviously, there's a lot of intravenous drug use in our country, and if there are that many illegal injections, you would have to guess that a portion of them are probably not using sterile needles. Now, in terms of symptomology, what does this do? Typically, when someone first contracts HIV, they get flu-like symptoms. So they get a fever, they get aches and pains, they get those cold symptoms, probably some vomiting, and then it goes away, just like a flu after a period of time. The only thing that's a little bit different is that you do tend to see some swelling of the lymph nodes. So they might see some swelling and some tenderness in the armpits, in the neck, in the groin area, but then that'll usually subside and kind of go away as well. Now the issue is that even after that initial flu-like illness goes away, the virus does not. And the virus, as we kind of drew that little graph on the last page, the virus is just increasing its numbers inside that person. And as it increases its numbers, it begins to deteriorate the immune system because of decreasing T cell numbers. Now, when a person reaches a certain point that they have really low T cell numbers and their immune system has a really low activity level, they go from being HIV positive to having a condition known as AIDS, right, which stands for Acquired Immune Deficiency Syndrome. Today, I got a note here at the bottom. Today, there are treatments for HIV positive people. There is no cure for this disease, but these expensive treatments can sort of increase the longevity of the immune system and the person's life. In other words, it makes it so that it takes much longer to go from being HIV positive to having AIDS and then potentially dying. In the 1980s, this could be really rapid, right? In other countries, there are different types of HIV that can be really rapid. I think we'll talk about that later on before our class is over. But in the U.S., that typically isn't what happens. It's a little more slowly progressing, and if the people can get treatment, then it'll slow it down quite a bit. Now, here's the interesting part, right? So what does this look like? It can be difficult to diagnose HIV. People think maybe they had the flu, and then it goes away, and they go back to normal. But again, internally, their immune system is shutting down. So they start to get frequent illnesses, right? Other infections. They'll start to waste away. They're kind of tired all the time because they've got these infectious agents kind of picking at them. They'll get multiple sinus infections over and over again, which most people wouldn't get. They'll get weird infections. They might get some sort of weird, like fungal infection of the lungs, or they'll get multiple cases of pneumonia, which again, a normal person just doesn't tend to get that. And those are signs that the immune system is breaking down. The other thing that's weird about HIV is that typically the virus itself isn't what kills you, right? It is just wasting away your immune system so that something else kills you, right? And usually that something else is bacterial pneumonia, bacterial deep-rooted infection of the lungs, which is just very difficult to treat. And if the immune system is not really working, then there we are, and that person will tend to die because of that other infection, but not really directly from the HIV virus itself. Couple notes up here. One of the most famous people to be HIV positive is Irvin Magic Johnson, fantastic basketball player from the 80s and 90s, very well known. And again, because of kind of the mystery around HIV, when he found out he was HIV positive, he immediately retired from the NBA, and probably had to, because there were players who didn't want to share a locker room with him because they didn't know how HIV could spread. Players probably justifiably might not have wanted to play with him because of the potential for an injury that could share their blood, and so he left the game. And he's one of the best players that has ever lived, and probably could have kept playing for longer. But he's also now poured a lot of money into research, obviously for his own good, into kind of treatment of HIV. The other thing here to point out, Tom Hanks does not have HIV or AIDS. Tom Hanks, as you know, is an actor, and he was in a great movie called Philadelphia. Now, it's a drama. It's kind of a sad movie. But Philadelphia is a movie about a lawyer, played by Tom Hanks, who contracts HIV, and then basically is I can't really remember now off the top of my head who he's trying to take to court over this, but Denzel Washington plays another lawyer who then comes out and defends him, and kind of makes the controversial decision to defend him. And I'm pretty sure it's based on a true story, but it's a very good movie if you've got nothing to do during the quarantine to check out that movie, which is about sort of that HIV epidemic we had. All right, last thing, and I know I've talked a lot through these slides, but this one will be quick. Last thing's Ebola virus. I added this a couple years ago, too. This is not one that you're likely to come into contact with, and I hope you don't ever in your life, but one that also was in the news fairly recently, certainly in a time frame that you could remember. And so Ebola virus is weird. It's a creepy virus. It's kind of long, like you see here. And the Ebola virus is creepy for many reasons. One is that symptoms appear 2 to 21 days after exposure. So you might contract Ebola virus and not show symptoms for 3 weeks. Now think about, again, in our current situation with coronavirus, think about how many people you would typically interact with over 3 weeks in normal circumstances. So it's almost impossible to track how much that Ebola virus could have spread from person to person if someone was carrying it without symptoms for 3 weeks. Once it does cause symptoms, they're very, very bad. Causes a severe fever, causes the worst headache you've ever had in your life, causes muscle aches and pains, causes severe weakness, causes diarrhea and vomiting, which is the most unpleasant thing you can think of, severe stomach pains, obviously no appetite when that's the case. And then Ebola virus is sometimes deadly because it is referred to as a hemorrhagic fever. There are a number of hemorrhagic fevers that we're aware of on the planet, but that means that you basically start to bleed. Your clotting systems don't quite work. your blood vessels sort of become a little bit more permeable than normal, and so people will just bleed from their skin, right? Bleed from their pores, bleed from their openings like their nose, their eyes, and so obviously that's terrifying as well, but it can be very deadly. In 2014, our world saw the worst Ebola virus epidemic it has ever seen. This was in West Africa in particular. There was spread to surrounding regions and surrounding areas. Fortunately, this was not something that really spread to the United States. But they think the Ebola virus outbreak was sort of a new strain that, again, spilled out over from either bat populations or actually from like monkey or primate populations to humans there. This 2014 epidemic, don't quote me on this, I think it caused about 11,000 deaths, and so 11,000 died, and I think that was maybe roughly a third of the cases. So, somewhere 30% of people who got it actually died, which is really scary. In the terms of the United States, we had 4 cases that were diagnosed in the United States. So 2 of those were people who, traveled internationally, came back to the United States, and then were diagnosed with Ebola virus. 2 others were locally acquired. So these are medical workers that interacted with the people who had Ebola virus. So there were 4 diagnosed here. I think they say there were 11 cases total on the ground in the United States, which means that there were probably 7 others that were sort of brought here or came here after being diagnosed with it, which sounds crazy, but sometimes that happens. And I think out of those 11 total, I believe it was 4 died. So again, kind of keeping with the roughly 1/3 number. So again, not an outbreak that we had to worry about in the United States, kind of catching in Kentucky, but still a very scary thing. So that wraps up our discussion. I don't think I said it. There are so many other bacteria and viruses we could learn. This is basically a whole course in medical school. But this highlights a lot of the ones that maybe you've had before, ones you've heard of before, and gives us some interesting ones that we can look at in terms of actual cases. So our next step is to apply this to actual patients, which I think you'll have a fun time doing. So thanks for listening, and I'll see you guys soon.